Okay, we're live. 3, 2, 1.
Hello and welcome to Wellness Live. My name is Dr. Olivia Moses, and thank you so much for joining us. If you're watching us live, this is the last Wellness Live of the entire year of 2023. And we can't thank you all enough for being our loyal viewers. And it is our hope that you have learned something along this journey that we've taken together. Today, we have a very special guest. Her name is Dr. Luke. She is a board certified dermatologist and she's the residency coordinator here at Loma University Health. And she is actually a fantastic resource for us for many different things and all things dermatology. But today she's specifically here to talk about skin health when it comes to communities of color. So, as you can imagine, this is a very interesting topic for me personally. So, I cannot wait to hear what she has to say. Now, if you are watching us live, you can actually ask Dr. Luke questions right here on this broadcast. So, go ahead, type those in the chat, and you'll have an opportunity to have your questions answered. So, without further ado, I'm so excited to introduce you to Dr. Luke.
Thank you so much for having me. It's really exciting to be here with Wellness Live. I'm going to start.
Yes, so Dr. Luke, why don't we pull up your presentation right now and then we will get started.
Okay, I'm just going to share my screen. All right. So, like Dr. Moses mentioned, I'm going to be talking about promoting skin health in communities of color. So the objectives of this talk is to understand some of the unique challenges that are associated with dermatologic care in communities of color. I want to talk about how to incorporate healthy habits into your own lifestyle for optimal skin health, and then understand the importance of performing a self-skin exam and seeking the care of a dermatologist for any skin, hair, or nail concerns. So why is it important to learn about skin of color? You may or may not know, but by the year 2050, the U.S. Census Bureau projects that over 50% of the U.S. population will be made up of people of color, with skin of color. So for us living in Southern California, and for myself with a very busy and diverse practice, this is very practical to me. But for people who aren't seeing a lot of patients of color, definitely know that there are patients of color that are seeking care. And this has become definitely more apparent for me in my dermatology practice. So for us to get on the same page and kind of have an understanding of what we're talking about, I'm going to talk about how skin of color is defined. Now, classically, skin of color, there was a Fitzpatrick scale that was created, and this actually was developed by a dermatologist. It's based on reactions or vulnerability of the skin to sunlight and UV radiation. So it really wasn't in the intent to, classify people based on certain types of skin. It was mainly to see what types of reactions occurred where type 1 or the lighter types of skin easily burned and never tanned, and type 6 type skin never burned and tanned very easily, and referred to more deeply pigmented skin. So classically, skin of color was defined as skin types 4, 5, and 6, and typically included those from African, Latin, Asian, Middle Eastern, Native American, different variations of ethnic types. But we all know that this is not, the end all be all, and there are some limitations given that there are only six types that are listed. So let's talk a little bit about the science of skin of color. I want to first, talk about what we see on a molecular level. There are keratinocytes, are skin cells, and then there are melanocytes. Those are the cells that develop and create pigment or melanin. So the ratio of keratinocytes to melanin in the top layer or epidermis of our skin is 36:1, meaning there are 36 keratinocytes that are going to interact with each melanocyte. So it's important to note that there are no racial differences in the number of melanocytes between races. There's also the main variation in pigmentation depends on how the melanin is distributed in those keratinocytes. So it's the amount, the density, the distribution of melanin, that's the primary determinant of skin color. And we do see some differences in melanosome size, density, and aggregation. We can see that melanosomes, those are the packets that store the melanin, are larger in those with African skin types and are smallest in those with lighter skin types. So when we talk about taking care of patients with skin of color, there are some challenges that we face. A lot of times we have some access issues or social determinants of health. There can be a lot of lack of awareness in communities of color regarding the issues that may need the help of a dermatologist regarding skin cancer risk and ways to prevent it. There are also some barriers to health care and access to dermatologists. This may be due to insurance issues, childcare issues, work issues. And so there are some things that can cause some problems and lead to delays in diagnosis and treatment. Additionally, there are some healthcare disparities, as we know, in medicine in general, but there are also some dermatologic health disparities, specifically in the conditions listed below. There can be a lack of diverse dermatology physician workforce. We know that the dermatologists of color or those who are underrepresented in medicine are only a small percentage when compared to the general population. This can be due to resident selection practices, lack of underrepresented minorities in academic and leadership positions, and then some pipeline issues as well, where they're not necessarily getting into dermatology overall. And then adequate training in skin of color dermatology. It's important to have representation in the curricula, the educational resources, and the clinical training. So while we as a specialty are working on a lot of these barriers to care, I'd like to focus on access to care, meaning increasing awareness for patients of color on why they may need to see a dermatologist. So with that, we'll talk a little bit about today 5 tips for optimal skin health in skin of color. And we'll broach these 5 topics: protecting your skin from the sun, maintaining a healthy lifestyle, developing a good skincare routine, performing self-skin exams, and then seeing a dermatologist. So let's first talk about how we protect our skin from the sun. There's a huge misconception in communities of color that people with darker skin have negligible risks associated with skin cancer. And while this may be true that the prevalence in skin of color is significantly less compared to those with lighter skin types. Typically, those with Latin descendants, they have a 5% risk of skin cancer, Asian 4%, African American 2%. The issue is that people with skin of color tend to be diagnosed with cancers at more advanced stage and tend to have a worse prognosis or poorer survival. And so Cormier and colleagues found that Hispanic individuals had an odds ratio of 3.6, African American individuals 4.2, and Asian individuals of 2.4, being more likely than Caucasian individuals to have stage 4 melanoma at the time of presentation. So melanoma is one of the deadliest types of skin cancer. And when you have stage 4, that means it's spread to other parts of the body. So as you can see here, if you've presented at a later stage, there's a tendency towards poorer survival. When we think about other types of skin cancer, for instance, basal cell carcinoma, UV radiation seems to play more of a role and tends to occur in sun-exposed areas, similarly in both skin of color patients as well as those with lighter skin types. However, for squamous cell carcinoma, which tends to be a little more aggressive as well, the lesions are more likely to be present in areas that are not sun exposed in the skin of color population. Similarly, for melanoma, UV radiation does not seem to be as much of a risk factor for patients of colors when compared to Caucasians. And similarly, this tends to occur on like palms and soles, around the nails, as well as on the mucous membranes. And so it's important to be aware of this so that you can check those areas. And if there's anything of concern, bring that to your dermatologist. This is just a schematic of what skin cancer looks like in skin of color. You can see here, similarly, like I mentioned, for those with basal cell carcinoma, where it tends to have more of a UV component, you can see there's a similar distribution of where the cancers are located. In squamous cell, like I mentioned, this tends to be not necessarily in sun-exposed areas, can be in the anogenital region and also on the lower extremities. For melanoma, again, similarly, we're looking at palms and soles, lower extremities, and the trunk. There's another misconception that endogenous melanin provides complete photoprotection for skin of color. People say, I don't need sunscreen. I have melanin in my skin. And I hear this every single day, and I have to constantly try to debunk some myths. So I'd like to share some things with you to hopefully give a little more insight into this topic. There was a study by KB et al., and they reported that the epidermis of patients with Fitzpatrick skin types 5 and 6 had an intrinsic sun protection factor, or SPF, of 13.4 versus around 3.3 seen in lighter phototypes. So yes, there is some enhanced protection, but it's not complete protection. And so just a little bit of background on SPF and what that means. It's the protection factor, and it's basically how well your sunscreen protects you from UVB rays in particular. And that's the way that it was studied, to look at UVB rays and not necessarily UVA rays or even visible light, which we know can sometimes play a role. So an SPF of 15 is going to block 93% of UVB rays. So similarly to the inherent SPF of 13, it's okay, but it's not, as good. And it's definitely not 100. An SPF of 30 blocks 97% of UVB rays. And then an SPF of 50 blocks about 98% of UVB rays. And so we see here, nothing's 100%, but we do, the American Academy of Dermatology, our national organization, does recommend at least an SPF 30 or higher. Additionally, like I just mentioned, visible light plays a role in skin of color in particular. And visible light exposure induces both transient and long-term cutaneous pigmentation in a dose-dependent manner. So depending on how much visible light you're exposed to, this is the light that we kind of deal with every day, this may cause darkening or discoloration in some patients of color. The visible light also induces free radicals and reactive oxygen species, and this can lead to a cascade of inflammatory lesions depicted in this photo. More intense and persistent visible light-induced pigmentation occurs in particular with those with darker skin types 5 and 6. So the visible light and oxidative stress, our studies show that an estimated 50% generation of reactive oxygen species was attributed to visible light exposure. So even more so than UVB, which we're always worried about and which we study and test for our sunscreens, and UVA. So we get a larger amount of reactive oxygen species formation with visible light. So studies indicate that visible light-mediated reactive oxygen species generation, it can damage the skin barrier, leading to photoaging, hyperpigmentation or dark spots, and then melasma, a specific skin disorder of hyperpigmentation, especially in those with darker skin types. So another reason to wear your sunscreen. There's increasing evidence that antioxidants may help mitigate these negative effects. And so for that reason, they're trying to formulate sunscreens also with antioxidants to increase their protection. So how to choose the right sunscreen for people of color. We recommend broad spectrum SPF 30 or higher. Like I mentioned, that's our national organization recommendations to cover both and protect against UVA as well as UVB. I recommend the addition of a tinted sunscreen with an ingredient called iron oxide, because that does help protect against visible light. And then you can look for sunscreens that are formulated with antioxidants to prevent reactive oxygen species formation. And then lastly, but not still very important. You want something that's cosmetically elegant. Traditionally, sunscreens were not really formulated with people of color in mind. And so they often left people white, chalky, gray, ashy, and they left a white cast. And so now we are getting, additional products, a lot of formulation and product development, specifically for darker skin types. And so we're able to find something that's more elegantly formulated and better suited for darker skin types. So I'm going to stop my share at this time to answer any questions.
Thank you, Dr. Luke. We actually have a question from YouTube coming in, specifically about sunscreens. And the question reads, are natural sunscreens even necessary? They seem to leave a white film, and I am hearing from some that regular sunscreens are safe and others that are more harmful.
Yeah, so this tends to be very hot topic. A lot of times people are kind of trying to figure out or determine if a mineral-based sunscreen is better for them compared to a chemical-based sunscreen. So I like to first start out by saying that all of them are chemicals, right? Even water, H2O, those types of things that even though they're natural and they're still fine for our bodies, all of these sunscreens are made with chemicals, okay? It's just whether it's a mineral based versus a different type of ingredient. So I usually tell people when I'm recommending sunscreen, my favorite one is the one that you're going to consistently wear every single day. So if you find one that is chemical based, and those tend to be the ones that blend a little bit better with darker skin tones, then use it. It's great. Sometimes people are worried about, is this going to be absorbed into my bloodstream and things of that nature. Sunscreens have been used for decades, and we have not found any of those implications or causations at this time. So mineral-based sunscreens, they are typically two particular ingredients, either titanium dioxide or zinc oxide. And so those are the common ingredients in mineral-based sunscreen. I like these for people with sensitive skin where they don't, or they have had reactions to chemical-based sunscreens. And then again, I recommend looking for a tinted sunscreen. So those are typically added to the mineral-based formulations. So for my patients of color, especially if they're dealing with discoloration or pigmentary issues, I recommend a mineral-based tinted sunscreen.
Okay. Now, might not be a fair question to ask you, but it is coming from another viewer. What brands do you like to recommend that blend well with people of color?
Yeah, so okay, so this is the thing, and I don't have any loyalty to any one brand. I don't have any, conflicts of interest or disclosures or anything. I love a lot of different sunscreens. I do have some that are my favorites for darker skin types, and like I said, I don't have any conflicts with any of these. Neutrogena just put out a great affordable option. It's their Pure Screen. It's available widely over the counter at Target. It comes in 4 different shades. So you can see if one of the shades blends nicely with your skin tone. It's also formulated with some antioxidants like vitamin E. Similarly, La Roche-Posay has one. It's called their Anthelios, which has a Celox shield, which helps. It's an antioxidant formulation that helps with some of that reactive oxygen species formation. It's tinted. And another one is called Color E Science, and they similarly make some tinted mineral-based sunscreens. And then one of my favorites is a chemical-based sunscreen, but it was specifically designed for Black women in particular. So it's called Black Girl Sunscreen, and so they've become very popular. So those, I would say, are some good places to start. Again, like I said, people are now formulating specifically for people of color. And so I think that's great that we are getting more and more options that are cosmetically appropriate for our skin type.
Dr. Luke, could you speak a little bit more about the tinted sunscreen piece of it? Because is this more of like a foundation that is going to cover up blemishes, or is it something that will blend well? Can you put it under your makeup? Those types of things.
So this has actually become one of my, additionally, one of my favorite topics. So the tint is just the part, again, that's going to add that extra ingredient to give us some visible light protection. But they're getting very, very savvy with their tints. And there's a couple products like It Cosmetics and Dermablend in particular make these CC creams where they do give you a little almost like coverage as well. You don't have to, and a lot of them, should blend in with your normal skin, the regular tinted sunscreens. But I am enjoying some of the CC creams that have been developed, and they give you a little bit of added coverage. So yes, I love both of those as good options if you do have things to cover, but you kind of want to still keep it light, not do a full face of makeup.
Got it. So when it comes to sunscreens, can you talk a little bit about how early we should start putting sunscreens maybe on our kids?
Yeah, so sunscreens are actually safe for kids at least 6 months of age. So while they're babies, little infants, you can certainly do kind of our general sun protection measures. You can cover them up with clothing and hats and seek the shade and things of that nature. But yes, sunscreen is safe for children as young as 6 months.
Now, when it comes to sunscreens and you're using other topical things, when is it time to see a doctor about maybe medications that you're maybe putting on yourself versus how it interacts with sunscreen? Should we worry about sunscreen and interactions with other medications?
So I usually recommend, and I do have a section on this on how to develop a good skin routine, but kind of to give you a little sneak preview, I usually recommend doing your cleansing and your moisturizing. If you need to apply any medications, it's best to do that on clean, dry skin. And then sunscreen should be kind of the last thing that you apply before you head out the door. I know sometimes people are worried about makeup and things of that nature. You certainly could, there's a couple tricks. You could blend a little bit of your makeup with your sunscreen if it's a liquid formulation, but technically your sunscreen should be your last step.
Okay. And then speaking of kind of the summer and we're now in the winter about dry skin, is sunscreen and moisturizer different or are they the same thing because it is a kind of cream that you're putting on yourself?
Yeah, so I actually love to rotate not only my moisturizers, but also my sunscreens in the winter. So when we're in the summer, we can do lighter lotions, things that are not as heavy. As we get into the colder winter, drier season, we should use thicker, more moisturizers and creams, but also sunscreens. So for that reason, I also look for some sunscreens that have some additional ingredients. And ceramides is one of those. It's something that it helps maintain a healthy barrier for our skin. And sometimes it can be depleted in certain skin conditions like atopic dermatitis or eczema. So I'm looking for sunscreens that have ceramides in them, sunscreens that are a little thicker or creamier in texture, and I save my lotions for during the summer.
Great. Well, speaking of the sneak peek, let's get to the second half of your presentation. Thank you so much. And thank you to our viewers for those questions.
Perfect. Okay, so now we'll talk about how to maintain a healthy lifestyle. We can't talk about promoting skin health without, promoting wellness in general. So I'm not going to go into a lot of detail about this, but just some lifestyle factors that do contribute to skin health. Of course, diet, and I know we've had a lot of great conversations on what to eat, what diet to kind of adopt. And of course, being at Loma Linda, we're kind of making sure that we're doing kind of a whole food, plant-based type of diet. This is definitely rings true for good skin health. Also, drinking adequate water, making sure that you're very hydrated, also promote good skin health. Additionally, exercise promotes skin health, adequate sleep, managing stress, and of course, not smoking. I think this is one of the key things where we can see accelerated aging, fine lines, wrinkles, deeper wrinkles, and also accelerated sun damage in those who are smoking. So I would say if you can incorporate these lifestyle factors, that's a good way to maintain good skin health. So developing a good skincare routine. Like I mentioned, and the purpose of this is not to go into anything very elaborate. If you feel that you need a specific recommendation, you should either see your dermatologist or a licensed esthetician, some professional that can help you with skincare. But I like to remind people that skincare does not have to be difficult. And so I usually recommend just doing a few steps. So, and I break these down into cleansing, of course, because we want to remove, any dirt, debris, any excess oils, any makeup. We want to remove that. So I recommend cleansing both morning and in the evening. I know sometimes people with their routines, it's sometimes hard to do things in the evening, but I do think you get that added benefit if you're cleansing both morning and night. Similarly, I mentioned having a good moisturizer, and you may need to alter that. Moisturizers are needed based on your skin type. So sometimes people have what we consider to be normal skin. It's not dry, it's not oily. It's just kind of, normal. Those who have oilier skin or acne prone may need to watch the types of moisturizers that they use, not maybe use those that are too heavy or give like an oily residue. You also may want to look for things that are non-comedogenic, meaning they don't clog your pores. Those with drier skin want to look for things that either enhance the moisture going into your skin, like things that are humectants, they draw water into the skin, such as hyaluronic acid or even glycerin sometimes, or they want to look for thicker creams that basically block the moisture from leaving the skin. We talked about a huge piece is protecting your skin. So I tend to think of that as your sunscreen. So really, if you had just cleanse, moisturizer, protect, that's a great regimen. And then I add this asterisk for treat and prevent. So those who do have medical conditions or skin things that need to have treatment, that's when you would think about, okay, where do I incorporate my prescriptions into my regimen? And so, like I mentioned, usually we have you apply any prescriptions or medications on clean, dry skin. And so this is sometimes done before the moisturization step. But you'll have to talk about that and do that in conjunction with your dermatologist. There are other things that great skincare ingredients that I could literally talk about all day. But you don't necessarily have to incorporate all of those things, just kind of based on what your skin is needing. And that's where I recommend that you see a dermatologist for additional guidance and prescription medication if needed. So let's talk about performing self-skin exams, because I do think this is a key aspect of skin health. So how do we perform a skin exam? So what we want to do is make sure that we are regularly examining all parts of our body. That way we kind of understand where certain moles are, what little growths may be around. And that way, if anything changes, you can bring that to the attention of your dermatologist. And so in order to do a self-skin exam, you want to use a full-length mirror to basically examine yourself, see all the areas, see as much as you can. Look at your underarms, your forearms, your palms, your legs, between your toes, your soles. As I mentioned, people of color tend to have skin cancers or melanomas on the palms and soles, so you definitely want to pay attention. But we also can have regular moles on our palms and soles. So again, if you notice anything that's dark or any new spots, particularly on the palms and soles, or even on your mucous membranes, like the inner corner of your lips or the actual lips themselves, those are things that you want to bring to the attention of your dermatologist. Additionally, you want to look at your neck, you want to look at your scalp. If you do get your hair either cut or you go to a hairstylist, have them also examine your scalp to see if there are any growths or any dark marks or anything that may be suspicious. And then lastly, you want to use a mirror to check your back, your buttocks, and your genitals. So again, doing a full skin exam for yourself to kind of know where things are. And then if there's anything new or concerning, then you can bring it to the attention of your dermatologist. Some surprising places that skin cancer develops, like I mentioned, the scalp. We've had a lot of patients come in at the guidance of their hairstylist. And so that's excellent on their part that they're able to recognize things that don't belong and notify people so that they can have it checked. Additionally, like I mentioned, the lips, those are those mucosal surfaces that sometimes can develop dark marks or even cancers. The hands, you want to look very closely at both the palms of your hands and turn your hand around and look at the other side, as well as the feet. The groin, we don't often look in this area. That's where I say sometimes a mirror is very handy. And lastly, looking at the eyelids to make sure that there are no growths either on the eyelids themselves or on the skin surrounding those areas. So the important thing to do is look for the ABCDs, E's of melanoma. So we've kind of created this nice little mnemonic because we want people to be able to recognize melanoma since it is the deadliest type of skin cancer, like I mentioned before. We use the A to stand for asymmetry. So you're looking at, your spot. Is it a nice round circle or are there certain parts that are hanging off to the side? B is for border. Was it like a nice smooth area and now it's irregular on one side or raised on one side? We add the C for color. So if you have a spot with more than one color or it's very dark in color, those are signs that this spot should be taken a look at more closely. The D stands for diameter. Typically, melanomas are greater than 6 millimeters or about the tip of a pencil eraser. It's important to note that they can be smaller. So if you notice any new spots, then just please let your dermatologist know. And then E stands for evolving. We look for things that are growing, changing, bleeding, doing anything strange or new spots that you previously didn't know were there. And then lastly, see a dermatologist. And so board certified dermatologists have extensive training. You may or may not know this. It's a fun fact. We can diagnose and properly treat more than 3,000 diseases of the skin, hair, and nail, as well as cosmetic concerns. I've been at Loma Linda for over 10 years, and I've seen a lot of conditions. And so as we see patients and, diagnose these things, we can certainly help patients who have any skin conditions or concerns. We also understand how serious skin conditions can impact your health and well-being. We can advocate for our patients to get what they need. And then in certain instances, your skin condition may be a sign of an underlying health issue, and the dermatologist can help recognize it and assist with prompt diagnosis and management. We'll take a little time. I'll stop sharing to answer some additional questions.
Well, thank you so much, Dr. Luke. We have some questions coming in, another one coming from YouTube. But I'm going to kind of add on to it. Right now, I think all the rage is the double cleanse. And so the question coming through is, can you over cleanse your skin?
So Okay, so this is a great question because I think traditionally the cleansers that were formulated in years past are certainly quite different from what they are today. So sometimes you needed, multiple steps. You needed like a toner. You needed to do all these different things. I think nowadays the cleansers are formulated quite differently. They are very nice. I personally do like double cleansing, particularly for people who wear makeup. The way that double cleansing works is that you use an oil-based cleanser first. And that again helps remove makeup, like I said, oil debris. And then you go in with a water-based cleanser, and then you do another layer of cleansing. So when used with, like I said, kind of today's better formulated cleansers, you should be fine. And then again, adding moisture, kind of looking at what cleanser would be good for you. If you have drier skin, do you need more of a creamy cleanser? If your skin is more oily, do you need like a lighter, more foaming cleanser? So I think as long as you are using the appropriate things, you're fine. And sometimes, yes, if you overdo it, I find people putting like alcohol and lemon and other random things on their skin. Yes, you can strip your skin if you're doing all of those things. I think using a regular cleanser once and then even doing the double cleanse method should be fine.
So another question, Dr. Luke, and when we're talking about skin health in aging, What are the things that we should be looking at? Because there's all kinds of things out there, and I think everyone online is an expert in dermatology and giving you
Right.
all kinds of advice, and they're selling products. Some of them interesting, some of them not interesting. Could you speak a little bit to the aging process and maybe, the use for skin of color, the retinols out there or the retinoids out there? Is that something that skins of color could benefit from?
Sure. So, yes. So, the thing about aging is that we have kind of the way that I like to think about it is intrinsic aging, right? What happens on the inside, our genetics, sometimes, you can have someone that looks amazing because they have great genes, right? But you can, and then there's the natural aging process where, our bones, there's bony changes that we see. There is fat redistribution. So there are all these things that are going on internally. We can't do much about that. But there's extrinsic aging, which we can do a lot about. And so we know that in particular, smoking affects extrinsic aging, our environment. So if we're in an area with a lot of pollution, a lot of sun exposure, our lifestyle can help with, like I was mentioning, aging. And so those are kind of things that are in our control. I will say in particular with patients of color, there's a slight variation in photo aging in particular. So aging that we see that's due to the sun. So we see that there are delayed signs of photo aging in patients of color, and that is due to the fact that there is additional melanin and it is protective. So the typical signs of photoaging that we see, fine lines, wrinkles, discoloration, things of that nature, don't occur until typically maybe a decade later in people of color, or sometimes even longer. I will say, though, we do have other things. So we have, like, we tend to get more benign growths or other lesions and things of that nature. So I still think there's a benefit for taking great care of your skin, doing excellent skincare. Retinoids are one of the things that have the most evidence behind them for their anti-aging benefits. They actually help stimulate collagen production in our skin. And so I do think as long as you can tolerate the retinol or retinoid, it's a good thing to use, like I mentioned, in combination with sun protection. And then sometimes people can use like an antioxidant to help prevent some of the damage that may occur. So kind of doing an all-encompassing approach with several different options are good.
Thank you, Dr. Luke. Another question that we have received is, are there any skin fads that we need to avoid?
Oh gosh, I mean,
I'm
yeah,
assuming the
all the
answer
time.
is yes. You probably have not enough time to list all of them now.
Correct. Half
Yeah.
of the like TikTok skin fads are you probably should not be doing. Again, run these things by your dermatologist, and I would not jump on every single fad, and I would just be very, cautious about people who are saying that they're experts that aren't actually dermatologists.
And then one final question, Dr. Luke, because there are so many products out there. I mean, we are bombarded by anti-aging, skin health. They come in, you can go to your average store, a Target, a Walmart, and get pretty potent things over the counter. Is there any advice when we're looking at, you can get a vitamin C vial and, a hyaluronic acid vial and, a salicylic, whatever it is, just those compounds alone versus others that are mixed in together. When we're looking at those kinds of things, when should we get a dermatologist involved when we're looking at those kinds of things?
I think it's important actually to get a dermatologist or an esthetician involved from the very beginning because, again, there's so much information. And again, there's the possibility, I have a lot of patients who are very savvy. They've done a lot of research and they've looked up different things, and that's great. And sometimes there are things that they find that are actually really great. But sometimes it's hard. And I know the majority of my patients have trouble kind of sifting through all of the information. And so while it's important to look for specific ingredients, sometimes you can find something that's formulated with a few ingredients and that can be helpful helpful. So I think getting your dermatologist or esthetician involved very early on, especially for product recommendations, can be helpful if you're not wanting to do all of the research yourself.
Wonderful. And maybe I'll slip in one last question. I think a lot of these things on TikTok and YouTube, a lot of it they say is natural. So they're mixing all kind of, herbs and spices and, oils and that types of things together. And because they're regular household items or things we eat, a lot of them claim that it is safe, it is natural. Can you give our audience your thoughts on that?
Again, I typically tend to be someone who looks to science, to research. And so, while yes, it's not harmful to you, is it effective? Has it been studied? Do we know that it actually works? And so, that's where I tend to have a slight more lean to for products that have actually been formulated and tested, or prescriptions that have been studied in clinical trials in order to better guide options for our patients.
Okay, well, great. Thank you so much, Dr. Luke, for
You're very
sharing
welcome.
your expertise with us. We're so excited to have had you. And I want to thank our audience. Thank you so much for joining us this session and this year through our Wellness Live journey. And we want to invite you to next year as well. And we will resume our regular schedule on the last Thursday of the month. And I could not end this year without also thanking the Wellness Live team. So we have a lot of individuals that help set up lighting, help set up the Zoom, work in the studio remotely for us. And I just want to thank all of them, Bobby, Ernie, Eric, Esmeralda, Kahari. Thank you all for making this year possible. And we can't wait to start Wellness Live again in January. We'll see you then. Merry Christmas, Happy New Year, and blessings.